Hi, this is your Houston chiropractor, Dr. Tristan Went, coming from Advanced Chiropractic Relief in Houston, Texas. And today I'm joined with Miss Kelly. Miss Kelly is a patient coming in for her very first chiropractic adjustment ever. She's from the greater Houston area here, so she traveled on over probably about, what, 45 minutes to come see us here today?
About an hour.
About an hour? Yeah, depending on traffic, huh?
Correct.
Miss Kelly's coming in with a primary complaint of low back pain and stiffness, primarily central with a little bit off to the left-hand QL-sided muscles. She's got a history of a right knee injury where she tore the patellar tendon and had some other ligamentous damage in that area that had to be surgically repaired, so she gets some occasional knee stiffness on that right-hand side. She comes in with some bilateral trap tightness and lower cervical stiffness and pain. She gets once a month suboccipital headaches, and then not much today, but occasionally she'll get some lower thoracic stiffness if the low back's kind of flared up on her as well. And then we mentioned the left wrist as well, and that can just get a little bit stiff from an old fracture that you had, that you actually refractured, I think, after the cast came off, right?
Correct.
So 2 fractures in the left arm. So we'll be showing you Miss Kelly's first visit today. And how did you find us here at Advanced Chiropractic Relief?
We were referred to you by Brandon Lincoln.
Well, shout out to Brandon. Thank you very much. And you've been seeing some of the videos with your husband and stuff too,
Correct.
right?
On YouTube.
And Miss Kelly was telling me that her husband wants to come in to see us eventually, but she's kind of the guinea pig for today. So we'll get her adjusted and make sure her head's still attached for her hubby after the first visit today. Okay? So Miss Kelly, we'll have you go face down here into the paper for me. And then we'll do a lot of those same checks that we already did. So reach up the leg length here. So she is short on the right by 1/4 of an inch, almost 1/2 an inch. And as we bring those up, it gets even, and it actually starts to get a little bit longer there at the end. And I've already confirmed this with Miss Kelly, but it tightens up just a bit there at the end, doesn't it?
Yes.
Yes, ma'am. And she feels a lot of that tightness, more so on the right SI joint, which correlates to what she's dealing with here in that L5-S1 junction on the left. So I'm gonna start on that right SI joint, Miss Kelly. I'm gonna work my way all the way up, like I mentioned earlier. If you've got any comments, questions, anything like that throughout the treatment, don't be afraid to stop me and ask, okay?
Okay.
The crack addicts on YouTube love watching newbies get adjusted, so. Big breath for me. And then all the way out. Lower this just a bit here. Not nearly as big as the last patient we had on the stage. And I'm actually gonna go skin on the yoga pants. Big breath. And all the way out. Good. All right, sacrum. Center sacrum. Left sacrum. Left SI joint. Big breath in for me. And all the way out. Last one. Good. Pressure okay? A little deeper than the videos you were watching home.
Yeah.
So next I'm going to go here to L5. And since these have never been adjusted before, these will probably be a little bit tender at first. They'll feel better once we get done with them today, okay? And something that you were reporting to me a while ago is that when I was going through palpation and P to A central vertebral pressure, you noted that there was soreness, but it actually felt good as I was taking you through these extension positions. And so as you get these adjustments done for the first time, you'll feel a little bit of that soreness sensation initially, but as long as you're focusing on that breathing pattern, going deep breaths in through the nose, out through the mouth, that'll make these a lot more comfortable for you as well, okay?
Oh.
Good. Big breath. All the way out. Good. Good. Last 2, okay? I'll give you a break after these. Good. Last one. Good. All right. So next I'm going to loosen up some of these trigger points here that we were showing you a while ago. Big breath in for me. All the way out. A couple more on this side. Probably another one of those hurts so good sensations, huh? Yeah. Don't worry, I'll give this job of being a pain in the butt back to your husband very soon, okay? I'll workshop that one. You okay?
Mm-hmm.
Right, deep breaths for me. You like to hold your breath a lot, don't you?
I do when it hurts.
Yeah. Don't worry, I understand. That's why I constantly remind you about the breathing patterns. Part of those habits we were talking about earlier. There we go. All right. So next I'm going to work through the lower thoracics here. Maybe take a nice deep breath in through that nose for me. And blow it all the way out. Yes, ma'am. Another big breath. All the way out.
Oh.
Yes, ma'am. You definitely needed this today, Miss Kelly. I'll give you a break after that one. I know it was very intense. A couple more here, okay? Can you manage it?
Mm-hmm.
Okay. Another big breath for me. And all the way out. Good. Crack addicts are definitely gonna love you, Miss Kelly. You're sounding off for them today. Good. Let those shoulders fall to the ground there for me. Good. Yes, ma'am. Last one here, okay? Can you handle it?
Yeah. Oh.
Good. Yes, ma'am. So now we're gonna recheck the leg length here. We like to do pre and post adjustment checks, and now she is exactly even in this position. Ms. Kelly, tell me how this feels when I bring the legs up this time. Does that feel any different in the lower back and pelvis?
I don't feel anything.
Awesome. That's what you come in here for, right?
Yeah.
So a lot of those things that I was talking about with the soreness and that initial sensation, has it all kind of calmed down and relaxed now afterwards?
Yeah, my lower, it just hurts like on my upper.
Yeah, a little sore there right now. Yes, ma'am. So have you go face down into the paper there for me. We've got one more here for the anterior head posture that we were talking about a second ago. Remember that old saying, no pain, no gain?
Yeah.
We use the analogy a lot in here of getting your first chiropractic adjustment, and even though it's your first chiropractic adjustment, even those that have been adjusted in the past will typically still develop some soreness after being adjusted here because we're a little bit more intense than your average chiropractor. There we go. That's another reason we don't have to see patients 3 times a week for 6 months like some chiropractors do too. So have you go face up for me next. So with this next one, I'm going to contact on either side of your cheeks, and we're going to work on getting your head back up over your shoulders, okay? Nice big breath in for me. 2 more. Last one. Good. Now if you go arms out to the side like a big old T, that's a Y. Down just a bit further. There we go, there's a T. The right piece. Next, I'm going to work on the AC joints, the sternoclavicular joints, and all of the anterior ribs as well. Okay. I'm going to slide down just a touch for these last couple. Perfect right there. Let's go clavicle next. Good. Last couple, okay? Last one. Good. Actually, I'm going to decompress next. I was getting into some old patterns there with showing the docs and stuff earlier. So now I'm going to decompress the ankle, the knee, and the hip with this next adjustment, okay? So all you got to think about is letting this leg go like a limp spaghetti noodle here for me.
Oh God.
So you should have felt that from the knee all the way up into that hip and low back, did you?
Lower back, yeah.
Good. You didn't know you were going to leave the office a little taller today, did you?
No.
Nice big breath in for me. There you go. Part of that holding the breath pattern again, huh?
Oh.
All right. Now I'm going to help you up here, Miss Kelly. We're going to swing those legs around and face Dr. J on this one.
I'm sweating.
That's how we know we get the sympathetic nervous system firing. And it's a little warm being by these windows, so that doesn't help either. Got that Texas sunshine through in the morning on this east side. So next I'm gonna work on the glenohumeral joints here. So what made you decide to come all the way over to North Houston to get your first chiropractic adjustment? Was it the videos or anything specific?
I didn't want, I guess I wanted it done correctly. And I was
You wanted to go
worried
to the
about,
best, huh?
yeah, I was worried about, where we live, not doing that, I guess. And then, yeah, and the guy that sent us here, you want research or you wanna know about something, he's the one who does research on everything.
See a patient here as well? or-
Yes,
Good.
and so, I trust him.
Well, that's always a huge compliment to the office and to Dr. Jane and I, is that patients referring family and friends, because that means they genuinely trust and want others to seek that second care, because they wouldn't be referring there if it wasn't gonna be helping them. Just living up to all the hype and things that you saw in the
Yeah.
video?
Yeah,
Probably even deeper, huh?
yeah, because I can feel the difference already.
Good. That's even without the decompression adjustment. Would you drop that left shoulder there for me? Yeah. Last one. Beautiful ring, by the way.
Thank you. I just got it.
Nice. Did you pick it out or hubby?
He surprised me with going to pick it out. So
Awesome.
it was a
Well worth it, huh?
upgrade for anniversary. So
Nice. Well, congratulations, you guys.
we're gonna upgrade at 20, and 20 came, and we're like, oh, we're not there yet. So we're
This
gonna
is-
wait till 25.
So his
but-
anniversary gift needs to be coming in and getting his first ring dinger, huh?
Right. We're gonna upgrade at 25, and he's looking at 22. So
Alright, I'll be his diamond ring, so. So next, Miss Kelly, I'll have you go butt right here, head up this way for me. I'll have you scoot down just a little bit this way. So this adjustment right here is the whole reason you and I are having a conversation today. This is the one that helped save me from back surgery when I was 19 and the entire reason I got into this profession. So I wouldn't even accept you as a patient if I thought this was gonna be harmful or hurt you in any means. Alright, some of you relax those hands under your tummy here for me, because I want to pinch them into the table here. Now these are going to be very, very tight, but they need to be, because this is what's going to stabilize your pelvis so you don't slide up the table during the adjustment. So you're going to be on our last pins, Miss Kelly. Can't lose any weight between this first visit and your next, because I won't be able to fit you onto the table, okay? And maybe slide down just a touch more for me. Good. There we go. What line was that?
that was.
So for this adjustment, all I need you to think about is keeping those teeth together for me. You don't have to clench them together, just clench them so that tongue doesn't go between there. And then just like we were working on earlier, we're going to take those same nice deep breaths all the way in through the nose. There we go. So as you exhale, it'll start to bring that spine into a nice big stretched position. Your body's going to want to tighten up against it. Just keep letting those muscles and letting those shoulders kind of sink down into the table there, okay? Nice big breath in for me. One more so I can time it up. There we go. All the way out. Move that left big toe for me.
Oh God!
Yes, ma'am.
Jeez.
Big breath.
Oh.
Yes, ma'am. That was a home run for visit number 1, Miss Kelly. I know it's very, very intense, but give it a couple deep breaths for me, okay? As you exhale on this one, let those legs sink and relax into the table. Good deep breaths. And all the way out. Good. Let that tummy start to sink and relax into the table there. So, Miss Kelly, how far down did you feel that one?
Oh my God! All the way to my lower back.
Good.
My shoulders and my neck hurt.
Yes, ma'am. So again, some of the soreness is going to be because you've never been decompressed like this ever in your life. 1, because you've never been to other chiropractors, and 2, because you've never been to this office. So if you do get sore, all you're going to do is take some crushed ice in the freezer baggie and put that directly on the skin, okay? So you go up the right hand side here first. I can tell you all these things too from first-hand experience, because it's all the things that I went through on my first visit in there with Dr. Johnson too. So,
Oh my gosh.
boy, oh boy, there's where those headaches were coming from. Big breath in. Yeah, last one way down here on the left. Would you drop that left shoulder there for me?
Oh.
So Miss Kelly, welcome to Advanced Chiropractic Relief. I know you're a little starstruck right now from all the adjustments, but that's where I've got some homework to send you back with to kind of keep helping everything calm down with the first big adjustment today. We just hit the nervous system reset on your entire body. Stand up here with me. We're gonna get back in front of the mirror and check out that posture. All right.
Oh my gosh. Oh, head rush.
Yeah, a little bit of a head rush getting up off the table like that. So I want you to take that same nice deep breath and work on the flexion and extension that we started the visit with. Good. Should feel smoother this time after that adjustment.
Yeah.
Don't worry, I've got some things here to keep while helping with the soreness. So if you bend that head forward there for me. So like I said, if you do get sore, just take crushed ice in the freezer baggie directly on the skin for 20 minutes. And you can do that every hour if you need to. So 20 minutes on, hour off, 20 minutes on, hour off. You can do that 4 or 5 times throughout the day. And you should expect some soreness for up to 72 hours. And the analogy that I like to use is if you went to the gym or went to one of your classes for the first time in a long time, guess what? You're not gonna feel so great for a day or two afterwards because you're gonna have some of that muscle soreness following. It's very similar to what the adjustments will do here today. You'll feel a little bit of that muscle soreness, but as long as you use some of that crushed ice and then follow some of the other homework instructions I'm about to give you here with an extension exercise, that'll help kind of reduce those sensations. Okay. So the extension exercise is 3 parts. Number 1 is gonna be shoulders up and back as far as you can get them. So I like to think about part 1 just being a reverse hug. So if somebody's standing behind you, you're trying to squeeze those arms together as much as you can. And I'll have you do this here with me in the mirror. So shoulders up and back, good. Part 2, you're gonna take the chin. We're gonna go straight back towards the wall behind you, good. Now we're gonna extend as far back as we can, good. Squeeze, squeeze, squeeze those shoulders. Good. One more on this side. And good, relax the shoulders and everything for me. And then one last time, just like we did to start the visit, I want you to go forwards and backwards. Now this should be the smoothest of them all, but you tell me. Doesn't kink up in the lower cervical spine like it did at the beginning of the visit, huh? Good. We've got much better spacing here between the pelvis on either side, and we're also not leaning off to the left-hand side anymore like you were earlier, and that's how I knew you were a side sleeper coming into the office today. So, Miss Kelly, other than sore and better, are you experiencing anything different right now? Because that's where we expect a lot of our newbies to be after the very first adjustment, excuse me.
It just
sore but better.
Yeah, my lower back doesn't really get it.
Good, good. So did this live up to all the expectations and hype that you had seen in the videos?
Yeah, I think so.
Now that hubby knows that your head's attached after your first visit, maybe you'll be a little more comfortable.
No, I definitely want him to
adjustment.
do it. I want him to.
Awesome. Well, you guys can come on in and he can get his first ring dinger, and maybe we can do a couples video or something with his first adjustment too, huh? Well, Miss Kelly, thank you so much for sharing your story here with all the Chiropractics on YouTube. I'm Dr. Tristan Wint, coming to you from Advanced Chiropractic Relief in Houston, Texas. Thank you guys for subscribing, liking, and following along with all of our patients' journeys, especially Miss Kelly's here. And we'll see you guys soon for your first ring dinger.